Hello and welcome dear viewers to the another topic on dissolution specification for modified release formulations. These formulations are also known as extended release formulations, modified release formulations, sustained release formulations, prolonged release formulations or XR formulations and also known as chronotherapeutic formulations. Then these are also known as modified release formulations, where the release of the drug substance is changed or modified in a such way that the patient will have benefit for the therapeutic outcome. And XR formulations have multiple benefits like improved patient compliance, less plasma fluctuation, and less number of doses per day. Many of the times the XR formulation contain a higher dose compared to the immediate release type of formulation. That's why the release for the modified release formulations become very critical, and many of the professionals find it very difficult or confusing to understand the dissolution specification and L1, L2, L3 stages for dissolution specification for the modified release formulations. So that I have made this video. Let's start with the main topic and then we will understand the L1, L2, L3 stages of the dissolution specification. Also we will see when this dissolution pass and when the dissolution fails. See for MR formulations, how to set the dissolution specification is based on the bioequivalence batch. Also, if the applicant have the IVIVC with the slower release and faster release profile, then dissolution specification can be given on the basis of IVIVC data. The reference for this video is the dissolution procedure development and validation chapter from the USP, and this image I have taken from the FIP guideline given in 1997 FDA guidance ER IVIVC. See here, the dissolution specification has 3 time points. First is after 1 to 2 hours, which involves 20 to 30% drug release, and this is required to provide the assurance against premature drug release. That means the dose dumping. Then the second point should be such that it will give 50% of the drug release. It is required to define the dissolution pattern, and dissolution pattern means the ER profile is maintained, and the last time point will be at least 80% of the drug dissolution will be completed, and it is required to be given to ensure the almost drug 80% of the drug is released. That means there is the complete release, we can say, at the last time point. So based on this the dissolution is given. Now let's see the example from the USP. Here extended release dosage form. In the following hypothetical example, which is used to describe the criteria for extended release dosage form, that may be capsule or tablet. The time points are 1 hour, 4 hour and 8 hour. All these examples I have taken directly from the USP chapter. The acceptance criteria or acceptance range for each time point is as follows. Between 24 to 44 of label claim drug substance dissolved at 1 hour. This is for 1 hour. then 56 to 76% drug release or dissolved at 4th hour, and not less than 85% of the drug is released or dissolved at 8 hours. So if you consider the 8-hour profile, for 1 hour around 30% should drug get dissolved, at 4 hours around 60% drug should get dissolved, and at the end of 8 hours 80% drug should get dissolved or this drug get released. So now you have the percentage drug release criteria, and let's see how we can fit into the L1, L2 and L3 criteria. See, for L1 stage 6 tablets are tested and acceptance criteria meets if no individual value lies outside the each of the stated ranges. So whatever the ranges you have given at 1 and 4th hour, so each individual unit should be within that range. So the range is 24 to 44. All these units, including this one, 24, it is within this range. So maximum is 44 and minimum is 24. For your easy understanding, I have considered this, while the average is 35. For the second, minimum and maximum I have covered here for your understanding, and the mean is 67. Now these two have completed. Now no individual value is less than the percentage specified in the final time point, and final time point is not less than 85%. So each individual value is above 85%. That's why this is the example of the criteria L1 passing. Here the L1 criteria is passed. Now if the L1 criteria are not met, then 6 additional tablets are required to be analyzed at level 2, that is L2. Now here please understand that whatever the specification you have given, for L1 stage your formulation is passing if all the individual values are within the given ranges. And see here in L1 stage the average is not discussed. Why? Because if your individual values are passing, then certainly your average will be passing. That's why average is not discussed here. And for average, nothing is talked regarding. Only the individual values are talked or individual values are considered. Now let's move to the another slide. So here L1 criteria is failing. Why it is failing? Let's see. 24, 44, and here one value is above 44, that is 47, while another is 22. See here the average is passing. Another case, 4th hour time point, one is 55, another is 78. Here also in 8th hour release, not less than 85%, here it is the 84%. So this table is only for your easy understanding. While you practice the actual cases or actual formula dissolution results, that time it may pass or fail at some time points. However, it may fail at another time point. Let's say it comes 44, but here it will fail. So here the individual values are not within the specified ranges. That's why L1 is failing. Now if L1 fails, then we have to take other 6 tablets, another set of 6 tablets or additional set of 6 tablets, and the dissolution is performed. Now let's see the L2 criteria. The average value of 12 units lies within each of the stated ranges. and is not less than the stated range of the final time point. Here, average value came into the picture. That average lies within the stated range and is not less than the stated range of the final time. Then second is none of the 12 tablets is less than 10% of the label content outside each of the stated range. And none of the 12 tablet is higher than the 10% of the label content below the stated amount at the final test time. So 10% criteria is given here for the individual tablets for the range. Now let's see for 1, 4 and 8 hours. This was your range for L1. Now from 24 to 44% it shifted to 14 and 54. Here you can consider this 34 as average to have easy understanding. Then 56 to 76 considering 66 as average. Here 46 to 86. So here 10% minus, here 10% plus. 24 minus 10%, it is 14%. 44 plus 10%, it is 54%. So from the individual value mean or average, it is shifted 20% at higher side and 20% at lower side. Here if you consider 34% minus 10% will come 24% and 34 minus 20% will come 14%. Similarly it will go 54. Similarly for the 4th hour it will go 46% and 86%. While at the last time point of 8 hour it was not less than 85% at L1 stage. Now it is shifted to 75%. That means 10% decrease is there. So now see how the L2 stage is passing here. Here 12 individual unit data is given. This is hypothetical data and I have made it for only understanding. So no unit is less than 14%. No unit is above 54%. Similarly here 46 to 86% range is maintained and the average is also passing the criteria of L1. If you see this 24 to 44 average is 31, 56 76 average is 63, not less than 85 it is 88, while no unit in L2 stage tablet is also below the 75%. That's why this is passing with the average. Here you can see the L2 criteria that the average value of 12 tablets lies within each of the stated range and is not less than the stated range of the final time point. So here the final time point is 88% while the criteria is 75%. Now when the L2 will fail, now see L2 individual tablet was given a criteria of 14 to 54% while 1 unit is 13%. Here also 1 unit is 45%, but the averages are passing. So your L2 is failing. Now you have to take another 12 tablet set and perform dissolution on the 12 units. So at L1 you have 6 tablet data, at L2 you have 12 tablet data, and now at L3 you will be having a data for 24 units. So 6 plus 6 plus 12 becomes 24. Many of the people get confused between the number of tablets at each stage. So please consider that in L1 6 tablets are tested, at L2 another 6 tablets are tested, while at L3 the fresh 12 tablets are tested, and that's why at L3 stage you will have data with 24 number of units. Now let's see the L3 stage. So if the L2 criteria are not met, then 12 additional tablets are tested at L3. The L3 criteria are met if these 5 conditions are met. And what are those 5 conditions? The average value of 24 tablet lies within each of the stated ranges and is not less than the stated range at the final time point. Then not more than 2 of the 24 tablets. In L2 stage it was not no unit. That means no unit was less than 10%. Here not more than 2 units out of 24 tablets. Here also not more than 2 of the 24 tablets are above 10% and the lower by 10%. None of the 24 tablets is less than 20% of the label content outside each of the stated ranges, and none of the 24 tablets is less than 10% of the label content below the stated amount at the final time point. So L3 stage is little bit critical to understand. See here, for 24 tablet data, not more than 2 units should be outside the 10% range, and none should go outside the 20% of the stated range. Now please consider and have a understanding that whenever you have 24 units data, that time the 2 units should not be outside the range of 10% and none should be outside the range of 20%. See here, I have given the individual amount dissolved for the L1, L2 and L3 stages. For your easy understanding, your L1 criteria was 24 to 44, L2 criteria became 14 to 54. Then at L3 it became not more than 2 tablets outside the range of 14 to 54. That means the criteria was for L2, that is 10% outside the limit for 2 units, not more than 2 units or 2 tablets. Now no individual tablet is outside the range of 4 to 64. That means here 20% is added. Here 20% is deducted. 24 minus 20, that becomes 4, and here 44 plus 20 becomes 64. Similarly, at the second time point, not more than 2 tablets are outside the range of 46 to 86, and no individual tablet is outside the range of 36 to 96. Then come to the final time point, not less than 85%. Here not less than 75% at L2 stage, and here in L3 stage not more than 2 tablet release less than 65%. So now it is clear that once you go from L1 to L2 and L2 to L3, you are getting relaxed limits. But it is not like that all the individual units will enjoy this relaxed limit. And this is why, because if this relaxed limit is given to all the units, that means all of your batches will pass. And considering the MR formulation, it is very important for the patients who are consuming the tablets. Those tablets are of equal quality, and each day the patient will receive the tablet with same dissolution profile. That's why it is critical for the MR formulations to meet these dissolution criteria and to understand when the formulation is passing and when the formulation is failing. Then coming to the L3 stage, it is passing, 1 unit is below the stated range. As example I have given here 13% and at 4 hours it is 45%. But if it goes below 4% here, that means if it is coming 3%, then it will fail. And you can exercise these tables. You can write down these figures from the table, and you exercise and have the complete understanding that when the dissolution will fail and when it will pass. Once you do this numerical exercise, you will never forget these dissolution stages requirement. If you go on reading only, then you will certainly forget about these criteria. So I request you to exercise these numerical values and see whether it is failing or passing. Simply you can take Excel sheet and do this activity. Now see here the specifications I have considered for BE batch. It is a hypothetical example. The BE batch data is giving 34% at 1 hour, 66% at 4 hours, and 95% dissolved or release at 8 hours. So based on this, 10% minus I have done and 10% higher I have done for L1 stage limit, 24 to 44, 56 to 76, and this 85 will be the same. Now once you go to L2 stage, higher limit and lower limit will be there, which will be 14, 54, 46, 86, 75 and 65. Now you can see here, you will get the relaxed limit for your specification, and this will be higher limit, this will be the lower limit, while the last time point will be nearly same. Then coming to the L2 stage, here it will also get relaxed by 20%, while the last time point will have relaxed limit of 75% for lower limit and 65 for higher limit. Higher limit means it is the more relaxed limit than this limit. So it will become your higher limit and this will become your lower limit. So from 65 to 75 you can get, but this is based on the individual unit data. So I hope this video might have given you understanding and clarity about the L1, L2 and L3 stages for dissolution. And the modified release specifications are generally finalized based on the bioequivalence batches and clinical batches data. Also, IVIVC is possible for MR formulations, as the MR formulations have typical release profile, and with the IVIVC data of slower release and medium release and faster release, these specifications can be given with more wide ranges. So this is regarding the dissolution specification for modified release formulations. Dissolution is a very important topic in all the interviews, and it is generally asked in the interviews that how you set the dissolution specification. So separate video is made on that topic. You can go to the playlist and watch those videos. I am happy to see the response from the viewers that people are watching this channel and they are learning. So thanks for watching the video. Please do like, share, subscribe to this channel and share with your friends. Thank you.